If you're trying to understand Medicare supplement plans, also known as Medigap, you're in the right place. My name is Cameron Giardini with Giardini Medicare, and today I'm going to walk you through everything that you need to know about these plans that help cover the financial gaps left by original Medicare. By the end of today's video, you will understand exactly what Medigap plans are, how they work, what they cost, and whether or not they could be right or wrong for you. Before we get started, I do want to make it very clear that we are only focusing on Medicare supplements in this video. We are not talking about Medicare Advantage plans. We will have a separate video about Medicare Advantage 101 in the near future, so make sure you hit the subscribe button so you don't miss it. Also, make sure to join our private Medicare Q&A Facebook group where we can help answer your specific Medigap questions during your transition to Medicare. You can scan the QR code on the screen, or you can find a link to that group in the description.
I like this groove.
Let's start with the basics. Medicare supplement plans, they are private insurance policies designed to work alongside with original Medicare, which are Part A and Part B. They help cover the out-of-pocket costs like deductibles, copays, and coinsurance that Medicare doesn't pay for. Without Medigap coverage, you would face costs such as the Part A and Part B deductibles, daily copays for hospital or skilled nursing stays after a certain point, and the infamous 20% coinsurance for most Part B services. How much of these costs will be covered by your Medigap plan? It strictly depends on the specific Medigap plan letter that you choose. Don't worry, we will explain the various Medigap plan letters later in this video. Because of how these plans function, that is why they are commonly referred to as Medigap plans, since they help cover the financial gaps left by original Medicare. So again, Medicare Supplement is Medigap and vice versa. Once you enroll in a Medigap plan, original Medicare, Part A and Part B, it remains your primary insurance, and your Medigap plan becomes your secondary coverage. Medigap plans, they do not replace original Medicare. Instead, they work with it. When you go to your doctor or provider, they submit a claim to Medicare first, and then a process called a crossover with Medicare happens automatically, and Medicare forwards the remaining claim to your Medigap insurance company. This happens behind the scenes, so you don't have to file any of the paperwork yourself.
Sounds easy enough.
This is often why your provider will ask you for both your Medicare card and your Medigap ID card during your visit, or at least the first visit. This crossover process, it is important to understand because it means that providers, they should not be billing you until after both Medicare and Medigap have the chance to process the claim. Only when there's a portion not covered by either Medicare or Medigap coverage should you receive a bill. One of the primary benefits of Medigap plans is that they have no network restrictions. You can see any provider in the country that accepts original Medicare. According to the Kaiser Family Foundation, as of 2022, about 89% of non-pediatric physicians were accepting new Medicare patients. But still, a common worry that we hear is, will my doctor accept my Medigap plan from insurance company X? Here is the great news and a key thing to understand. Medigap plans, they don't have their own separate network. If your doctor accepts original Medicare, they are required to accept payment from any Medigap plan for Medicare covered services, and the insurance company name on your Medigap card, it does not affect whether or not a doctor will accept your plan.
It doesn't matter what the name is.
Because of this, we need to emphasize Medigap coverage is fundamentally different from HMO and PPO plans you may have had in the past. We often have people say that they want a PPO Medigap plan, or they want a Medigap plan because they want a PPO. But with Medigap coverage, it is not an HMO or a PPO. You have to forget these traditional health insurance terms. Medigap plans, they function completely differently than any other health insurance that you've likely had in the past before Medicare, and thankfully, this is a good thing. However, it is important to note that while you can go to any provider that accepts Medicare, it does not mean that every doctor has to accept you as a new Medicare patient, so always keep that in mind. Another great feature is that you don't need referrals to see specialists. Although some specialists might require a referral from a primary care doctor, that is a requirement of the doctor or the specialist and not a requirement of Medicare itself. Perhaps most importantly, coverage decisions, they are made by Original Medicare, not the insurance company. This means the insurance company providing your Medigap plan, it doesn't decide what services are and are not covered. Medicare does. Recently, we have heard from many of you and our clients that are concerned about news stories of insurance companies denying or delaying treatments due to prior authorization. I want to clarify that these news stories, they are talking about Medicare Advantage plans, employer plans, individual health insurance, whatever it might be. It does not apply to Medigap plans. While Original Medicare may very rarely require prior authorization for certain very specific treatments, again, these decisions, they are made by the Medicare program itself, not the insurance company providing your Medigap plan. Now let's discuss what Medicare typically covers and how this directly impacts what your Medigap plan will help pay for. Determining exactly what Medicare covers can be tricky because it often comes down to medical necessity and how services are coded. That is why you are often better off asking your provider and their billing department if they think a service will be covered by Medicare based on your unique healthcare needs. For example, if you ask, does Medicare cover continuous glucose monitors? The generic answer is yes, but it really depends on whether you meet specific medical criteria. These criteria are often too complex for brokers like us to give definitive answers on what Medicare may or may not cover. Another example is skilled nursing coverage. Yes, it is covered by Medicare, but what if you don't have a 3-day qualifying inpatient hospital stay beforehand? Then it's likely not covered. If you do want to find out what services Medicare may or may not cover, some good resources include Medicare.gov, the Medicare What's Covered mobile app, or the Medicare and You handbook. For those of you who want even more detail, we will link to the Medicare coverage database in the description below. You can see an example of it here on the screen, but we really caution against getting too into the weeds with these regulations and really leave it up to your doctor.
Just too many variables.
Having Original Medicare and Medigap coverage doesn't mean that all potential coverage issues just disappear, as some like to make it seem. It is quite likely that you will eventually encounter a situation where Medicare doesn't cover something as you expect. If this happens, be on the lookout for an advanced beneficiary notice, also known as an ABN. You might receive this form from your doctor or supplier before a service if they believe Medicare might not pay for your services for your particular case. Also, because Medigap plans follow Medicare's lead, they also don't cover services that are not approved by Original Medicare. Common examples include routine dental and vision care, fitness memberships, and even routine physical exams. That said, some Medigap insurance companies, they offer additional benefits as add-ons to their Medigap plans. Some even provide coverage for non-Medicare covered preventive services like routine physicals. Working with a broker will be crucial when trying to find a specific Medigap company in your area that provides these extra benefits if that is important to you. There are also a couple common exceptions when Medigap plans do in fact cover services not covered by Original Medicare. These include foreign emergency coverage, although typically not enough, and we do recommend travel insurance when possible, as well as an additional 365 days of hospital coverage if you're inpatient longer than what Original Medicare allows. Let's move on and talk about who can get Medigap plans. The main criteria for Medigap eligibility is that you must be enrolled in both Part A and Part B of Medicare to also enroll in a Medigap plan, since again, it's secondary to Original Medicare. Just know you can apply for Medigap coverage before your Part A and Part B actually take effect, but your Medigap plan's effective date, it won't be until Part A and Part B are also both effective. Another major eligibility factor includes age considerations. Those eligible for Medicare under age 65 due to disability, end-stage renal disease, or Lou Gehrig's disease often have limited plan options compared to their 65 and older counterparts. Cost will likely be much higher for those under 65 looking for Medigap coverage, and this will depend greatly based on where you live. For example, in Pennsylvania, all Medigap plan letters must be offered to individuals under age 65 during their first 6 months with Medicare Part B and at the same premiums as those 65 and older. By contrast, in Arizona, Medigap plans, they aren't even available to those under 65. Just know these state-specific rules, they can change as legislation evolves. For example, Indiana recently mandated that all Medigap plans be offered to those under age 65, with certain plan letters premiums not exceeding specific thresholds. Now it's time that we talk about the famous Medigap plan letters. Currently, there are 10 standardized Medigap plan letters that consumers can enroll in. You can see these listed side by side on the chart from the official Medicare and You handbook.
It's confusing.
It looks overwhelming at first, but there are a few things about this chart and these plan letters that you need to understand. First, despite these letters adding to the overall alphabet soup of Medicare, they all simply identify different Medigap plan options. When you hear plan letters, think Medigap. Don't confuse these with parts of Medicare, like Part A, Part B, which again make up original Medicare, Part C, which is used to describe Medicare Advantage, or Part D, which is prescription drug coverage. Again, remember, plan equals Medigap and part equals Medicare or Medicare Advantage and Part D. Second, Medigap plans with the same letter have standardized medical benefits. This means that Medigap plans with the same plan letter have the same basic medical benefits regardless of the insurance company providing the plan. For example, Plan G provides 100% coverage for all Medicare covered services, except for the Part B deductible, which is $257 per year in 2025. Whether you have Plan G from Company X or Company Y, you will have the same coverage for the medical benefits shown on the chart. However, like we mentioned, companies can offer additional benefits like fitness memberships or discounted dental and vision and more. So while we brokers, we do like to say a G is a G or an N is an N, it's not technically always the case. Third, when we look at the Medigap chart, there are two plan letters, Plan F and Plan C, that many of you watching are probably not eligible for. Unless you were first eligible for Medicare before January 1st, 2020, meaning that you turned 65 or became eligible for Medicare before that date, you cannot enroll in either of these plans. Despite Plan F technically providing the highest coverage because of its monthly costs and premium increases, even if you're eligible for it, it is simply not a plan we generally recommend. So that's the good news for anyone who wants it but can't get it. Finally, despite the long list of plan letters, only a small handful of plans make sense for most people. To keep things simple, we recommend focusing on just 3 different options: Plan N, Plan G, and the high deductible version of the Plan G. This focus will help you cut through much of the confusion when you first see the Medigap chart, and we have many other videos that you can see on the screen which describe these 3 plan letters in much more detail, so watch those next. Here is something crucial. Eligibility, it does not equal the ability to enroll in a Medigap plan. Unlike Medicare Advantage plans or marketplace health insurance, Medigap plans, they often require you to qualify based on your health and pre-existing conditions. Enrollment is not always guaranteed. There are 3 key enrollment options for Medigap plans. Number 1, Medigap Open Enrollment, also known as the Medigap OEP. Number 2, Guaranteed Issue. And finally, number 3, which is medical underwriting. First, Medigap Open Enrollment is a one-time 6-month period that starts the first month that you have Medicare Part B and you are 65 or older. Despite the name, please do not confuse this with the Medicare annual election period, which occurs from October 15th through December 7th every year. During your individual 6-month Medigap OEP, you can enroll in any Medigap plan that you're eligible for without answering health questions or paying more for pre-existing conditions. For example, if you turn 65 on August 14th, 2025, and you enroll in Part A and Part B effective August 1st, your Medigap OEP, it would run from August 2025 through January 2026. However, if you turn 65 and you only enroll in Part A because you're still working for a large employer, and then you retire at age 69 and enroll in Part B, effective July 1st, your Medigap OEP, it would instead occur from July through December, despite being a few years past age 65. Next, guaranteed issue rights, they differ from Medigap open enrollment, and they often occur with specific life events, such as losing employer coverage, moving outside of a Medicare Advantage plan service area, or using your 12-month Medicare Advantage trial right period. These guaranteed issue rights, they also let you enroll without health questions, but your plan options will likely be more limited to specific Medigap plan letters, with Plan N often not available. Also, some states like the ones shown on the screen, they have birthday or anniversary rules or other open enrollment periods that give you guaranteed issue rights to change plans annually, but often with some limits. We'll link to a guide with more details in the description. If you don't qualify under such a rule or another guaranteed issue situation, you can still apply to change Medigap plans any time of the year-round. Yes, we mean 365 days of the year. However, this usually requires medical underwriting, answering health questions, and the insurance company can deny your enrollment application to the new Medigap plan based on your health history. Again, acceptance is not guaranteed. If you do want to try to change Medigap plans through medical underwriting, please do not wait until the fall annual election period, if possible, since in reality, that is probably the worst time to make a change, since brokers and insurance companies are flooded with millions of people trying to change their Medicare Advantage plans and Part D plans at the same exact time. Instead, if you do want to go through medical underwriting, please do it before then. To better understand the Medigap underwriting process, you can watch the video that you can see here on the screen after this one. Now for the part that most of you have been waiting for. How much do Medigap plans cost? The monthly premiums, they depend on several factors, including the plan letter you choose, your location, your gender, your age, and your health status in certain situations, also whether or not you use tobacco products. Since we can't break down each factor in detail, you can see maps on the screen comparing the prices a 65-year-old can expect to pay for the popular Plan G, Plan N, and the high deductible G across every state in the country. Medigap premiums, they also typically increase as you age, so now you can see a similar map on the screen for what these costs might look like if you're applying for plan letters at age 75 instead of 65. To find specific Medigap quotes for yourself, you can use Medicare.gov. You input your zip code, your age, your gender, and other factors like potential household discounts, and you will see a list of companies offering prices for specific plan letters. Of course, comparing plans is even easier with an independent broker, so make sure you use our link in the description to connect with us or one of our partners to do so. Remember, Medigap prices, they are in addition to what you pay for Medicare Part B and standalone Part D prescription coverage, which we will cover very soon. Medigap pricing also depends on how premiums are rated. This determines what you pay when you first sign up for your plan, and it also importantly impacts how your plan's premiums increase in the future. There are 3 types of Medigap premium ratings. First, we have community ratings, where everyone pays the same monthly premium regardless of age when they first enroll. These premiums may increase due to inflation or other factors, but never based on your age. The next rating system is issue age rating. Your premium is based on your age when you first buy the policy. Generally, younger buyers will have lower premiums compared to somebody at a higher age applying for an issue age plan. These plans do not increase simply as you age, though again, they may still increase due to other factors like inflation or claims. And lastly, we have attained age rating. Your premium in this case is based on your current age when you enroll and increases as you age as well. Typically, these age increases are about 3 to 4% per year. And again, this is in addition to other increases like inflation and claims related increases. A lot of focus is placed on how Medigap plans are rated, but frankly, we think this topic is a bit overblown.
How dare you?
The premium rating for your specific Medigap plan that you choose will ultimately most likely be determined by the state that you live in. And you can see a map on the screen showing the most common premium rating methods in each state. Instead, by far the most important thing that you need to know is that your Medigap premiums, they will increase. In the past, we would have said to expect 5 to 7% premium increases every year. But we didn't realize that we were living in the good old days. And now, due to higher than normal rate increase trends, which you can see here, you should mentally prepare and budget for 10% or higher annual increases. Average increases, they will vary by plan letter. Plan N typically has lower increases than Plan G, and the high deductible G has the lowest increases of the three. Although we hope rate increase trends start to decrease soon, mentally preparing for higher than expected increases is always a good idea.
It's going to be a bumpy ride.
Like we mentioned, because Medigap plans are designed to cover the same services as original Medicare, they don't provide coverage for most prescription medications you'll get at their retail pharmacy. This is where standalone Part D prescription drug coverage comes into play. It is completely separate from your Medigap coverage and offered by private insurance companies that contract with Medicare. In 2025, the average premium for Part D plans, it's about $45 per month, but it can range significantly from $0 per month all the way to triple digits per month. The plan you will choose, it ultimately comes down to the specific medications you take, and thankfully we have a video guide showing exactly how we find Part D plans and how you can do the same. Now, as a quick note, some medications such as insulin used by an insulin pump or injections done at the doctor's office, these typically fall under Part B of Medicare instead of Part D. So in those cases, if your medication is covered by Part B, your Medigap plan will likely pay some or all of the cost, depending on the plan letter. Let's finish by looking at the pros and cons of Medigap plans, starting with the pros. First, they have predictable low out-of-pocket costs. With the most popular Medigap plan, once you pay your Part B deductible, your Medigap plan will cover your remaining Medicare-approved costs for the remainder of the year. This makes budgeting easy and gives peace of mind, especially for those of you needing frequent medical treatments. Number two, there is nationwide provider coverage. Medigap plans, they allow you to see any doctor or hospital nationwide that accepts original Medicare. There are no restrictions and no referrals required, making it ideal for those who travel or visit multiple states frequently, or simply for those of you who enjoy flexibility when it comes to where you get care. Next, prior authorization is very rare. With Medigap, if Medicare covers it, your plan will pay. No extra approvals or delays. This means fewer headaches and faster access to care. Next, they are guaranteed renewable. As long as you pay your Medigap premiums, your Medigap policy cannot be canceled, even if you develop serious health conditions. Now for the disadvantages, since of course they exist. They have higher monthly premiums. Medigap plans cost more each month compared to Medicare Advantage plans. Medigap premiums, like we said, they also increase over time, becoming more expensive as you age. Next, Medigap plans do not have prescription drug coverage, so you'll need to purchase a separate Part D plan. This often adds an extra monthly premium, and it requires managing a second policy, which does change yearly. Next, they have limited extra benefits. Medigap plans, they don't typically include coverage for routine dental, vision, or hearing, or gym memberships. With Medigap, if you want coverage for these services, you'll likely need to pay out of pocket or purchase a separate insurance policy. And again, with Medigap plans, another negative is the inability to change. After your Medigap open enrollment period ends, changing Medigap plans, it does often require passing medical underwriting in most states. This means the insurance company will review your health history and they can deny you coverage or charge you higher rates based on pre-existing conditions. However, just note that if you decide Medigap coverage is not right for you and later you want to change from Medigap to a Medicare Advantage plan, you can do this during valid enrollment periods without needing to answer health questions. Remember, the right Medigap plan for you, it depends on your personal health needs, your budget, and your preferences. There is no single plan that is right for everyone. If you want personal guidance on choosing a Medigap plan, please connect with a broker using the link in the description, and also check out the video on the screen for how to choose a specific Medigap plan.